the results we presented here are a combination of the phase 2 and the phase 3 study. And we combine those studies knowing that's not usually how you want to look at the data, but it's a small number of patients, so we felt like we would be able to say something meaningful by combining those two data sets. And the eligibility for the patients in both the phase 2 and the phase 3 ASCERTAIN study were relatively the same. The dosing and the regimen was the same, and the design was very, very similar. So it was a good opportunity to gather a historical bit of patients treated with 727 and see how they did. And we were quite pleased to see responses in about 80% of the patients with dysplastic CMML, and good, not quite as much, but maybe 50% response in the patients with proliferative CMML, which was promising. But the really interesting thing was the survival curves, and we were pleased with the survival, at least versus historical controls, and it deserves some follow-up. And there's a lot of prospective work being done now with this agent in the AMMO study in Great Britain, where Dan Wiseman and his colleagues are looking at ASTX727 as a single agent prospectively in CMML patients, and that's enrolling. And also in abnormal marrow. And abnormal marrow is an international collaboration for the MDS, MPN, IWG. And our first study, abnormal marrow 001, has several arms that are randomly allocated that include 727 plus an additional drug. 001 arm A is 727 plus itacitinib, which is a JAK inhibitor, and that arm is currently enrolling in the United States and about to open in France, Germany, Austria, Spain, and Italy. We're going to open another arm of this study later this year, which will open wider in Europe and in other countries in North America. So we're really excited about abnormal marrow and the promises that brings to quickly test new therapies for patients with CMML and get hopefully drugs approved quickly.